Whether mental illness was a factor in the shootings, Lopez was being treated for it, and he was being evaluated to see if he had post-traumatic stress disorder, a condition that is overwhelming the military. David Martin has more on that.
In 13 years of war, more than 150,000 servicemen and women have been diagnosed as suffering post-traumatic stress. And that, says Dr. Lori Sutton, formerly the Army's top psychiatrist, doesn't begin to tell the story.
We know that there's been an approximately 60% increase in psychiatric diagnoses within the force since 2001. Of those, actually, PTSD it's the smallest category. The majority are adjustment disorders. There's also depression, anxiety, substance abuse.
Soldiers are screened before, during, and after each combat tour. But still, mental health workers fail to spot dangerous soldiers. John Russell gunned down 5 fellow soldiers at a mental health clinic in Baghdad in 2009, the day after a psychiatrist judged him not to be a threat. Robert Bales, who slaughtered 17 Afghan civilians in 2012, was on his 4th combat tour, and no red flags had been raised about his mental state.
Our ability to predict and hence prevent mass violence is still in a very, very limited stage of development.
Officials admit they did not expect the wars to drag on so long, and as a result have been playing catch-up, racing to hire more mental health workers and develop programs that work, both for service members and their families. There are now 9,500 mental health workers in the military, and last year they had 10.5 million visits from patients. The number of new cases of post-traumatic stress is beginning to go down, but the psychological aftershocks of these wars will be felt for years. The Army is actually increasing its mental health budget, even though the fighting is coming to an end.
David Martin at the Pentagon for us tonight. David, thank you very much.